as lockdown 3.0 begins, multiple questions are being asked. Are we testing enough? Why are the cases rising daily? Are we close to finding a drug, a treatment protocol? India's Health Minister, Dr. Harsh Vardhan, understands the real picture of the pandemic better than many of us. Dr. Harsh Vardhan is our guest right now. Thank you so much for speaking to CNN News18, Dr. Harsh Vardhan. As the lockdown 3.0 begins, sir, how would you describe India's fight against COVID-19?
India's fight against COVID has been very exemplary. This is something which is acknowledged by every Indian and people all across the globe. The World Health Organization has also lauded our efforts. Indians have shown extraordinary determination, extraordinary courage to fight COVID.
So your ministry has been releasing data every day with a casualty rate of 3.26% and over 40,000 cases in over 90 days. With every day we are saying that is the highest single day spike. How do you bring down the rate of daily infection? Is that a challenge?
You see, you have to appreciate that COVID-19 is a very, very infectious virus and it spreads very fast in the community. That is why my immediate concern is not this issue that you are raising, but my concern has always been to catch everyone who has got the infection, to catch the patient very early, to make sure that if someone has a symptom, he is tested, and if he is positive, he is immediately shifted to a hospital or a health center or a COVID care center, so that we do not have unwanted, unnecessary mortalities in the system because we could not take a COVID-infected patient to the hospital or the system well in time. So even if there are more and more of tests, more and more of patients, as long as I can give them the best treatment,
that's right,
cure them and take them back to the homes fully recovered, I am happy about it. And our data speaks, I think, quite well about it. Already 10,000 patients have recovered. They have gone back home.
Sir, on 20th March, India tested close to 14,514 people. Percentage positive was 0.43%. After testing nearly 10 lakh people, the percentage positive has gone up to over 3%. How do you read this graph?
I think our graph has been steady almost continuously. It has never shown a steep hike. It has never shown an exponential rise. Moreover, as you are yourself saying, that we have tested over 1 million people and we have shown only 3% positives. And this is happening in spite of the fact that our guidelines say that we have to test every symptomatic patient. And now, through the revised guidelines in recent times, we are even testing SARI patients, we are even testing ILI patients, and we are testing them even in so-called unaffected districts, even in so-called non-hotspot districts, and of course doing it in the hotspot districts also. So I am quite content with this.
You know, sir, why has the number of deaths in the last 1 week gone up? Is it because of the stigma that is associated with the disease and people are choosing not to reach healthcare centers with mild symptoms?
I don't think it has anything to do with either the stigma related to the patients or the doctors or the ostracization of the doctors. Anybody who falls sick or who has even the initial symptoms of the disease, because they have been so widely publicized through all possible modes of communication, I don't think that there is even a single individual in the country who is not reporting to the health system. So there is no chance that people with stigma attached to them by the society may not report to the health facility. As far as the number of deaths is concerned, our analysis shows that most of these deaths are amongst the comorbid condition patients. And our endeavor has been throughout to ensure early diagnosis and early transfer to the hospitals. That is why when we get a message about a COVID positive patient from anywhere, we even rush our ambulances from our COVID dedicated hospitals to their homes and bring all such patients to the hospitals as early as possible, because my concern is to ensure that no one dies in this country because he could not avail of the health facilities well in time.
Dr. Harsh Vardhan, though we are ramping up our testing capacity, but many argue that it's much less than when we compare it to other countries. Will you not agree more testing is needed? And if yes, what's the optimum number that you are looking at, and is there a timeline?
Our testing strategy has been devised by ICMR, one of the most respected and prestigious organizations of the country. We have experts from all fields who have formulated the strategy. From time to time, we have kept on revising the strategy, modifying it, depending on the needs or the occurrence of the disease in the society. From one lab in the country, we have now a network of over 420 labs in the country. In a day, we are testing almost 75,000 people. We have already done 1 million tests. We have, in fact, plans to test 1 lakh people per day. And we are making sure that anybody who has got symptoms, he has to be tested. Our testing strategy is not vague. It's not about testing everybody whether he has got a symptom or no symptom. We are testing in a very, very judicious manner, and that is why I can very safely conclude that the results speak for themselves. The way India has been able to handle, the way India has been able to ensure that we have a steady curve, these are all indications of a well-crafted strategy, not only for testing but for other issues also.
Sir, given the size of our country, is the government of India looking for community-based random testing?
Yes, of course. We are doing it quite regularly, and we are doing it in all the districts of the country, at least 250 persons per district, and more particularly cases of severe acute respiratory illnesses and influenza-like illnesses in the OPDs, in the hospitals. And I know that there are some states like Karnataka and Odisha where they are doing it more aggressively than the rest of the country. And our National Center for Disease Control in New Delhi is monitoring these testings all over the country.
Last question to you, Dr. Harsh Vardhan. Many economists are making the argument that since our mortality rate is so low, probably we should open up the economy in one go and treat people as much as the cases come. The view is quite contrary to most of public health experts advised to flatten the curve like South Korea model. You have a view and understanding of both these sides. What's the way forward for India? MHA has shown the path for next 2 weeks. What after that?
I think our government's thinking is very clear. It has been elaborated in no uncertain terms by our Prime Minister himself when he said that Jaan is also important and Jahan is also important. For me as Health Minister, my foremost duty is to save each and every life from any disease that he can succumb to. So as far as the strategy goes, we are into a dynamic strategy to mitigate coronavirus. But you have seen yourself that we are now opening up in the lockdown phase also. And all that is being done by the Home Ministry is to ensure that we are able to take care of the economy also, and we are able to help the people who have suffered because of this economic slowdown post-lockdown.
All right. Thank you so much for your time here, Dr. Harsh Vardhan, India's Health Minister, for taking all the questions and for clarifying